The Communicable Diseases Agency, CDA, is stepping up some public health measures in view of the rising trend of measles that we see in Singapore. This is something that we see in conjunction with the rising trend that WHO has observed around the world. As of 2024, WHO has observed about 11 million cases of measles worldwide. This is about 800,000 cases, more than what they see in the pre-pandemic era. So there is a rising trend, and this is also reflected in the increased cases we detect in Singapore. In January this year, we detected about 11 cases of measles in Singapore. This is compared to 2 cases in January last year. And these 11 cases is not surprising because of the rising global trend. And also Singapore is quite open and exposed. We have a lot of visitors as a trade hub coming into Singapore. Singaporeans also travel quite widely. So in these 11 cases that was diagnosed in January, about 7 had travelled in the recent past. 1 was actually a tourist, and in fact 3 were young children below the age of 12 months. So because of that, we decided to step up public health measures, because what's interesting is that there were 3 cases that were genetically linked when we analysed the profile of the genetic material from the virus. But while they are genetically linked, they are not close contacts of one another. So this indicates that there's some degree of community transmission. But the good thing is that actually in Singapore, we have actually very high herd immunity in our population, more than 90% actually. So the vast majority of us, because of our mandatory vaccination program, are already immune. So it's quite different from what we experienced in COVID, right? And therefore, the vast majority of us who are already immune forms a very important first line of defense against measles infection in Singapore. But why we are stepping up public health measures is because there are still small pockets of people here who either because they are immunocompromised and unable to mount a response and immunity against measles, or because there are children below the age of 12 months who have not yet received their MMR vaccine, the measles vaccine. So to protect these vulnerable groups, small pockets of vulnerable individuals in our community, we decide that public health measures are necessary to form a protection around them. So what are these measures that will be implemented? First, there will be mandatory notification, because this is something that we have practiced for a long time. Measles is a notifiable disease in Singapore. And we will contact trace every single case of close contact so that they will be put on isolation. Infected cases, of course, will need to undergo isolation, either in hospital if they need treatment, or if they are not required for hospitalization, they will undergo mandatory isolation at home, up to 21 days. For those who are not immunized and are close contacts, they will need to undergo isolation for up to 21 days. Or if they receive, say, immunization or prophylactic treatment with, say, post-exposure treatment, or if you can show that their immunity has been achieved, they may then leave their isolation much earlier. If they are also vulnerable, that means they are close contacts and they are young children who are not immunized yet, or if they are immunocompromised, or if they are pregnant women, then they could receive, say, post-exposure prophylaxis. And if they show some immunity, they may then be taken off the isolation much earlier. So these are kind of measures we put in to protect the vulnerable. And I think what we can do is collectively as a people, if you have young children at home who have not yet been immunized, and you yourself has not had vaccination, then the best thing to protect your family would be to go for vaccination yourself. And for Singaporeans who like to travel a lot, I think we need to take care. If you have symptoms and you're not sure, see a healthcare provider, get yourself treated or diagnosed. And if you have come into contact with others who may be a measles infected case, then protect yourself and others around you by taking all the necessary precautions, hygiene, self-precautions that we have actually all done and practiced before during the COVID crisis.